Hello, I'm Dr. Lakeisha Jarrett, and I'd like to welcome you to the YWCA's Talk on Health. This is a partnership between the YWCA of the Lower Cape Fear and the Wilmington chapter of Delta Sigma Theta Incorporated. I will begin by giving a land acknowledgement. The YWCA of the Lower Cape Fear serves the people located in the Lower Cape Fear region. This land once thrived with life from the indigenous peoples, known today as the Cape Fear Indians and the YWCA Indian people. Living in established settlements along the Cape Fear River and Lake Waccamaw, along with many other established sites in the region. We need to protect and honor the history of those places. Indigenous people are not relics of the past. They are still here, continuing to demonstrate their talents and gifts amidst a backdrop of ongoing colonialism and oppression. They are worth celebrating. We hope our land acknowledgement statement will inspire others to stand with us in solidarity with Native nations. Thank you very much. Today, we are going to talk about cardiovascular health. We have some great panelists here. I am going to allow them to introduce themselves. But I'll first say that I am Dr. Lakeisha Jarrett, and I am a family medicine physician with Wilmington Health. I have been a practicing physician for 20 years. Chelsea, would you like to introduce yourself?
My name is Chelsea Stubbs. I work at New Hanover Regional Medical Center in the coronary care unit. I've been an ICU nurse for over 15 years.
Thank you. Judy, would you like to introduce yourself? You're muted, sorry.
Yes, my name is Dr. Judy Lentola. I'm a hospitalist at New Hanover Regional Medical Center. I've been practicing there for about 2.5 years. Some of my interests are in cardiovascular health, and that's why I'm here.
Thank you. Ashley, would you like to introduce yourself?
Yes, thank you. My name is Ashley Miller, and I'm with the Cape Fear Region American Heart Association, and we just want to make our community healthier.
Thank you. And Sarah, would you please introduce yourself?
Hi everyone, I'm Sarah Maurer. I'm a dietitian for a private practice called Summerfield Custom Wellness. And actually I'm currently in Durham, North Carolina, but before moving here, I was the dietitian at a cardiac rehab center in Boston, Massachusetts.
Very good. Well, we look at these talks on health as a way to reach the community and answer some questions that you might have about cardiovascular health. So we have composed some questions here, and we'll start now. The first question, anyone can chime in who would like to speak. Why is heart disease the #1 killer for women?
I'll go ahead and talk a little bit about this. It's not really that's a loaded question, obviously. So I could talk on and on about it. But one thing I wanted to spread awareness about is that women present differently when they're having heart attacks compared to men. So, men tend to have the classic crushing chest pain, that bring them into the hospital. Women can have they're sweaty, they're nauseous, they just don't feel right when they're having a massive heart attack. So certainly spreading that and letting women know that if they just don't feel right to come in, that's something that's so important, because I think because women don't have the classic symptoms that are advertised, they tend to come in later than men. And obviously the later you come in, the poorer the outcomes.
Thank you very much. Would anyone like to speak on the accuracy of wrist blood pressure cuffs? Chelsea, can you speak about that?
I'm gonna just click on. Yes, I find that the arm blood pressure cuffs are not as accurate as doing a cuff pressure. I mean, sometimes in ICU we tend to rotate to different sites, and I always get it in. It's not as accurate as my arm. Either it's a little too high or a little too low, and I just think that it's easier for everyone to give themselves a cuff pressure around the arm, around the wrist, and they just tend to sell more because it's easier, but it's not as accurate. So I would say do the best you can to get a regular cuff pressure cuff, and to try to make sure you get it calibrated. That's another thing. People don't get the machine calibrated. So once they get their new blood pressure cuffs, they just think it's good forever. And at some point, you have to go and have it calibrated.
Well, I would like to add to that, since I'm a family medicine physician in the community. We also often have our patients to bring their cuffs in so that we can compare the blood pressures that they have on their cuffs that they're taking at home to the cuffs that we have in the office. So that's one way to help determine if your cuff is accurate. I'm going to switch to a nutritionist question here and bring Sarah in. Sarah, can you tell me how diet can improve heart health?
Yeah, certainly. So of course, genetics does play a role in how we how we manufacture cholesterol, but diet plays a huge role because sort of that raw material in the first place to manufacture cholesterol can be altered. So if we are, really watching a diet closely or closer, that can really help the end result. Does that answer your question? Do you want me to go more into detail?
I'm sorry, yes, please give us a little more detail. I apologize.
Okay, so do you want me to talk a little bit more about?
You can talk about a high fat diet, specifically if you would like to talk about what's considered a high fat diet and what's considered a more heart healthy diet.
Okay, yeah, so it's typically recommended that 20 to 35% of our daily calories do come from fat. Fat's really important in our diet just because there are a lot of fat soluble vitamins, as well as there's fat makes up tissues in our body too. So we do need fat. The better question might be just what fats do we need? And so we want to typically go for the unsaturated fats over the saturated fats as much as possible. So the reason behind that is because saturated fats have shown to increase our LDL cholesterol, which is the cholesterol that we want to be low. And the unsaturated fats help increase our HDL, which we want to be high. So HDL, sometimes I phrase it just that it kind of goes around where it sees that LDL being made and kind of helps break it apart. So we want to increase the unsaturated fats, which are going to be, the olive oil, avocado, the oily fish like salmon, nuts, especially walnuts, flaxseed. That's all going to be really good. The saturated fat is going to be kind of found more in animal products. So if you think about a steak and kind of that like grizzly part on it, that's going to be some of that saturated fats, whole fat, dairy or ice cream, and then some commercially produced items might have some saturated fat kind of put into them so that it's that texture that we know and are familiar with. Does that answer your question?
Yes, thank you very much. I appreciate that. The next question is back to medical provider. I have heard that high blood pressures are normally called a silent killer. That is a language that we often use in the community. Why is that? And does hypertension have symptoms?
So I'll go ahead and take this one. I'm sure, being a family medicine doctor working in private practice, Dr. Jarrett, you kind of echo this over and over again, but in working in the hospital, I see the repercussions, so to speak, of not being compliant with blood pressure medicines or having high blood pressure. And there's certainly two phases. You know, there's an acute phase of having high blood pressure. I mean, high blood pressure, if it gets too high, can instantly cause a stroke. It can cause your heart to be stressed and cause you to go into heart failure acutely if it's very, very high. And those things can be dealt with if you come into the hospital pretty quickly and we reduce the blood pressure. But I honestly feel like the worst part of having high blood pressure are the long-term effects. And so if you don't manage your blood pressure appropriately, you know, go to the doctor and make sure you keep it, you know, within goal limits, you can develop things like renal disease. I've seen patients come in and, you know, have to go on dialysis when they're otherwise healthy because their blood pressure was uncontrolled for a long time. It can cause heart failure over a couple of time, over a period of time as well. And so they call it the silent killer because, you know, if your blood pressure is 200 over 100, you know, sometimes a lot of people don't feel that. The people who do are the lucky ones. You know, they have headaches, they have chest pain, and they come in and get it rectified. But often when you're used to your blood pressure being that high, you don't feel any different. And in fact, when patients come into the hospital and we see a trend of them having blood pressures that high, when we lower it to a normal range, they actually feel terrible. They actually feel bad when their blood pressure is normal. And so we try to lower it slowly. The point being that your blood pressure is high, you don't feel it, but it's slowly affecting your organs, causing renal failure, causing heart failure. And these are the patients that, you know, should have been on a well-controlled blood pressure regimen at 40 and come in at 55 and they're in renal failure and heart failure. So that's why they call it a silent killer. You don't feel that 200 over 100, especially if it's been there for a while, but it certainly causes lots of comorbidities that could have been avoided if you had, you know, had the appropriate preventive medicine and had your blood pressure controlled, you know, for years before it happened.
Thank you. I would like to, you know, tag on to that question and ask Chelsea. I see a lot of patients who don't want to take blood pressure medication. And could you talk about if there are things that lifestyle changes that people can make that would keep them from having to take blood pressure medications, and whether some people will still have to take blood pressure medications if they even make those lifestyle changes?
Yeah, it's a few lifestyle changes that I think are really easy. One of them would be to decrease your sodium intake. That would affect your blood pressure, but a lot of people eat so much sodium, they don't realize how much salt they're eating. Just, I mean, 2 tablespoons of salad dressing could easily run you 400 milligrams of sodium, and you're not even realizing it. You toss a little bit of cheese in your salad because you're eating healthy, and before you know it, you're at 800 milligrams of sodium, and you haven't even had any meat, you haven't eaten anything else. So I think if we could lower the sodium intake, eat fresh food, that would be better than some of the processed foods that we tend to eat. And even though we think they're healthy, they're laced with salt, which just keeps our blood pressure elevated, which keeps us retaining water, and it's just not a good thing. I find that a lot of the patients, they don't want to take the medicine. You have to encourage them and basically coach them into taking medicine that they know they need to take. I think if they eat garlic or some of the holistic regimens, that's all that they need, until all of a sudden now their cholesterol is elevated. All these things are happening at once, and they end up coming to my unit with a heart attack and not really realizing that those bad habits or just taking garlic wasn't going to handle their blood pressure accordingly.
Hi, it's Ashley, and I just wanted to add, at the Heart Association, we have our Simple 7, which are the 7 simple things that we talk about to maintain a healthy lifestyle. And it's eating right, getting exercise, keep moving, maintaining a healthy weight, and not smoking. I mean, people just don't realize how smoking is so modifiable in your health. And then, of course, knowing your blood pressure, your blood sugars, and your cholesterols, your numbers with your providers. But these are, 7 simple things that we hear every day. And it just takes a commitment to make, small changes can make a big difference in your life.
Thank you very much. Can either one of you speak about how smoking affects your blood pressure? Ashley, would you like to add on to that, or would you prefer that?
I'm going to let our medical professionals go first.
Thank you.
But I'm going to say this. I've noticed a lot of friends have picked up the habit during the pandemic because of nervousness or, and I don't like calling people out, but, I really would like some of my friends to change that habit.
Right.
So I guess physiologically speaking, I always use the analogy of, the pipe system in your home with my patients. So if you picture, the pipe system in your home, you flush the toilet or you go wash your hands and the water flows through the pipes. The pipes in our bodies are the arteries. And so what smoking does is it hardens the pipes in our bodies, makes them have less give, adds a coating to them, like, if you kept flushing paper towels down your toilets, and before you know it, you have a plumbing problem. You flush and the toilet fills up, or you go to wash your hands and the sink fills up and you have to call a plumber because there's a clog somewhere. There are clogs everywhere. And so smoking increases the clogs. And now your heart is the pumping system in your house. Your heart is trying to pump against such a high pressure, that pressure stays high. And then after a while, the heart gets weaker and weaker because it's having to pump against this a high pressure. So what smoking does is it essentially clogs up the piping system. And when the piping system's clogged up, the pressure goes high and the heart hurts as a result.
I love that analogy, Yuri. Thank you. Could you also add how cholesterol, diabetes, and hypertension would affect those pipes, please?
Yeah, so I really pride myself on trying to practice preventive medicine in the hospital, because I feel like a lot of people, unfortunately, don't go to you, Dr. Jarrett. They come to the hospital when things have gone wrong, and sometimes they don't come back to you. And so 2 points I want to make, and Sarah kind of alluded to this a little bit. There are genetics and there are environmental changes you can make. I want to say this because there are really a lot of people out there that even if they just eat grass for the next 6 months, their cholesterol is going to be high, their blood pressure is going to be high. There are people predisposed to their cholesterol being high, and I have seen this time and time again. It's way more important for these people to control their diet, but just controlling the diet is not going to be enough, and taking medications is really what's going to get their cholesterol and blood pressure under control. That said, so taking medications and lifestyle modifications are the 2 things you can do to mitigate these adverse effects of heart disease, hypertension, and diabetes. But diabetes and high cholesterol do the same things to your blood vessels that I mentioned. I think that high cholesterol is one that's easy to explain. I mean, if you eat fat, on a lot of fat, so you go get some chicken tenders, they taste good, you eat all of that, that lipid is really just flowing through your bloodstream, and lipids like to stick to the lining of your blood vessels. So if a young person's blood vessel is like this and blood is flowing through it, if you eat a lot of fat, what happens is that the fat keeps sticking to the walls and making the walls tighter and tighter. Where this is extraordinarily important is obviously in the heart blood vessels, because blood vessels feed the muscles of the heart. So a heart attack actually happens because you ate so much fat or had so much lipid floating around that eventually this wall gets closed off by fat. And if a part of the blood vessel feeding a muscle of the heart gets closed off, that's analogous to you tying a tourniquet around your wrist so that your hand doesn't get any blood. And so if your hand doesn't get any blood, over time you will feel pain. The muscle will start dying, and that's a heart attack. And so that's why we talk about these issues, because they happen very slowly over time, and they're preventable if you make the correct lifestyle changes and take the medications that your primary care physician recommends.
Well, let's go back to Sarah and talk about nutrition. Sarah, can you tell me how a nutritionist helps people to develop a heart healthy diet?
For sure. So my role at Summerfield Custom Wellness is actually to meet with people one-on-one. So typically we'll look at like what's going on in their life, what's their stress level, what's their sleeping like, what's these different lifestyle factors, as well as what's a typical day intake, what foods do they actually like, what's their family history look like, and help them create a plan that will be able to get enough fiber, lower sugar, the right types of fats, foods that they like, and foods that if they're a really busy person, that they will still have time to prepare for themselves. We also do different like programs and classes and that kind of thing too, if somebody doesn't want that like one-on-one type of thing.
Hey, it's Ashley. I have a question for Sarah.
Okay.
Tell me about healthy and your favorite snacks, because I can sit down and eat a healthy meal, but I can get stressed out or immediately hungry and I will grab the wrong thing in a hot skinny minute.
That's such a good question. Yeah. So I'd say healthy snacks. Probably, well, okay, I'll say that my favorite probably food in the world has to be peanut butter. Thankfully, there is unsalted peanut butters out there. There's also like walnut butter, almond butter, any kind of nut butter I absolutely love. I feel like it's a great way to get protein and some fats. And I guess I just want to leave a little caveat here too is almost all fats are going to have some component of saturated and unsaturated fat in them. So we definitely want the nuts in general. They're going to be mostly unsaturated. And you can pair those with typically a pretty fibrous food. So whether that's celery or an apple or a banana, that's something that I really love. And I just wanted to kind of make a note here too, why I bring up the fiber is because as that moves slowly through our GI tract, it actually helps pull out some of that bad LDL cholesterol that we don't want. So the more fiber, the better. Also can be really helpful for weight maintenance and helping our blood sugars to not go as high too. So yeah, I would say that's kind of one of my favorites. I also like, maybe like some nut thins and some guac. Nice thing about avocados, as I mentioned before, they have the right type of fat that we want, and they're also high in fiber too.
Thanks, Sarah. I know I'm definitely not a nutritionist, but over the last year or two, I've been getting more into fitness. Just, as you get older, you tend to pack on pounds. And so I've been trying to learn a little bit about this too. And one thing I would put out there is that snacks, the more air and the more water the snack has in it, the more it kind of fills up your belly without having so many calories. So for example, nuts, you could eat a handful of nuts and that could be the same amount of calories as half a bag of grapes, but the half a bag of grapes fill you up a little bit more. same thing with popcorn. You could eat a handful of chips versus having, a whole bag of popcorn. And so just knowing the caloric density of things I've found to be very, very important in snacking. And I tend to favor things that have lower caloric density. I hope I'm saying that right, meaning that if you ate a whole bowl this big, it's the same as eating, a small amount of something with higher caloric density.
Would you like to add anything to that, Sarah?
Yeah, I think that's a really great point that you bring up too, is we do need to be cognizant, especially, as weight can be a risk factor for heart disease as well, of the amounts, especially those denser foods like the nuts, to kind of looking at the maybe nutrition facts and seeing what is an actual serving size of this, and knowing that if I would sit down, because I love peanut butter, if I would sit down with the jar of peanut butter and a spoon, that might not be great. So making sure that we kind of measure things out accordingly. Mm-hmm.
Okay, thank you. And actually, I was going to add, I often tell my patients to go to the American Heart Association's website to look at the DASH diet, but I'm not even quite sure if you have that information on there. Could you or Sarah talk about the DASH diet?
I'm going to let Sarah talk about it if she's familiar with it.
So from what I know, less than 1,500 milligrams of sodium. Does DASH actually stand for something? Is it like?
Yeah. No, it's a low sodium diet for,
okay, I was like,
for patients with hypertension. Yeah.
Okay.
It comes from the brand of no sodium spices, right?
Yeah.
Is DASH maybe
Mhm.
the? Okay.
This is DASH. Yep.
Yeah.
Okay. Thank you very much. So is that information on the American Heart Association website, or can you tell me more things that might be on there that people can use as a resource?
I'm looking that up now.
Oh, okay.
and let me say that, science changes all the time. And
Right.
I love, there's a great video that was out that, in a certain amount of years, the lady was serving steak because steak was supposed to be good for you, or, just different things, lots of bread because bread was good for you. So
Yeah,
it's
we are in and out of love with eggs all the time.
And eggs, and yeah, lots of fish, not lots of fish, lots of chicken, not lots of chicken. So,
Right.
It's constantly changing. But when you do go on our website and put in recipes or low sodium or low fat in the magnifying box, we have tons of great resources, information for children, for adults that are, have a lot of medical knowledge, or just everyday layman's terms that you can share with anyone. But we have lots of great recipes and we have lots of great tips, and I'm going to look that up now. But we keep everything up to date with, the latest medical recommendations and scientific information, and that's something that we work really hard at.
Thank you. Now, Chelsea, I'd like to go back to you now. I have some questions about whether there have been more patients who have been hospitalized for hypertension during COVID. And also, if you could continue on to speak about heart failure. What is heart failure and how does that happen? And if you're seeing a lot of hospitalizations for that.
Okay. I won't say that we've been getting more patients for hypertension since COVID necessarily. I want to say my unit has actually been kind of empty. We haven't had as many. I think a lot of people have been staying home. They're having chest pains. They were having issues, especially at the beginning of COVID. We weren't getting hardly anybody. It was to the point where I was working in other units because we just didn't have any patients in my coronary care unit. But over time, we've started to get our patients back and whatnot. But I don't think that our intake is more because of COVID necessarily. What was the other question you asked me?
Well, let me just add on to that. Do you think that people were waiting longer to present to the hospital, and that they were more severe and farther along when they came in? Is that what you all were saying?
Yes, that's what we were seeing. Basically, that they were having chest pains or having cardiac issues, and they were just trying to wait it out, thinking that everybody, the hospital was full of COVID patients. They didn't want to come. They were afraid of that. Or we might not get seen because they're just seeing COVID patients anyway. I'm okay. That by the time they got to us, they were either COVID positive, and a lot of their cardiac issues didn't get handled right away because they got, taken to a COVID unit. And of course, no one really knew what to do for COVID at that point besides isolate them. So they were isolated. And I just think that if they'd have came a lot earlier, we could have done so much more for them. And a lot of them may not have had to die, but they just waited so long before they come in having chest pain. By this time, they're in so much heart failure that the muscles are died, and now they're struggling with COVID, trying to get over a virus with, heart issues, and which, as we know, COVID is a big culprit for blood clots.
Right.
So when you start mixing it all up, you just have a big problem, cardiac issue that we really can't help you. You can't breathe, you can't lay flat in order for us to do any procedures. So you end up just not getting what you need. Heart failure is when your heart does not pump effectively. And I find that this is the number one thing. I want to speak for minorities, especially. They don't understand what heart failure really is. They don't realize that the habits that they've been carrying since young adulthood up until, some of them earlier than 40, is catching up with them. They're smoking cigarettes. They are eating awful. They're not exercising, and they're fluid overloaded, and their heart just is pumping so hard with high blood pressure that they're not treating, that over time the heart just can't pump like it used to. And then you just go into fluid overload. So this fluid that should move through your body effectively, if your heart was pumping, starts backing up. So you start getting fluid in your hands, fluid in your ankle. And they like to say, I'm just gaining a little bit of weight, and a lot of times that's the fluid overload. That's all the sodium intake that you're taking. It's the uncontrolled high blood pressure that you're not handling. That's happening over time. And the worst part about heart failure is once you've gotten to a point with heart failure, there's nothing that they can do but get a new heart. And they don't understand that part. They just think, well, just fix me. And we, go through the changes of trying to fix them, put them on diuretics and, stuff to try to help facilitate their heart to pump. But over time, after a while, that just doesn't help either. And so I find that is one of the number one things that we get next to heart patients coming in with having a heart attack is having heart failure, because they'll come in with heart failure, get their doses of Lasix, and they start feeling better, and they go right back out and eat the same thing, with the same lifestyle that they lived before, and they just come right back. And so I think it's I don't know what we could actually do to reach the people, to get them to understand that those habits that you have, your diet, the lack of exercise, the lack of smoke, and all the smoking that you're doing is hurting you along the way. And it's nothing that we can actually do to help you in the very end, but give you medicine to help soothe you for the moment. But eventually you'll just fill up with a lot of extra volume, just fluid in your body.
Thank you very much, Chelsea. Sarah, are there any additional dietary recommendations for heart failure that you make that are different?
I would definitely say, with heart failure, the main one is going to be sodium and watching cholesterol. But I mean, the fats, of course, but a couple other things I did want to mention. Another one is fruits and veggies. I know that's super classic of a dietitian to say, but it's not just, it's not just the micronutrients and the antioxidants, which is anti-inflammatory in our bodies. There's something really especially cool about fruits and veggies is they have something called phytosterols in them. And so that kind of has a similar structure to cholesterol. So it actually competes for the absorption of cholesterol in our bodies and helps us not make that cholesterol as much. So gold star for the fruits and veggies. And kind of on that note with the snacks too, you know, however you can incorporate that in, maybe if it's carrots and hummus or something like that, that's another really good snack. I also wanted to say too, recommendation for heart health would be trying to stay under 25 grams of added sugar per day. So that can really, really add up. I think the last thing I saw was the average American gets about, I think it's a couple pounds of sugar a week in our diets, but it comes in so easily. You know, even our false friends, such as, you know, a sugary yogurt or a granola or a cereal, our juices, all of these things that, you know, have some healthy components to them can have a lot of added sugar in them, which can really raise our blood sugars, which we know that that's not helpful for our arteries, as well as you know, not great for our waistline as well. Let's see. Oh, and then just the fiber recommendation for women would be about 25 grams of fiber per day we want to shoot for. So certainly the beans, fruits, veggies, nuts are all going to have a lot of fiber in them. So yeah, I would say that from a dietary perspective, I would definitely want to make sure all of those things are in place.
Sarah, when you said 25 grams of sugar per day added, did you mean outside of natural sugars? So like if fruit is okay. I know that some fruits are better than others. You don't have to go into all of that, but do you mean on top of the natural things?
Yeah, that's actually a really good question. That gets confused a lot, natural versus added sugar. So something nice a couple of years ago, nutrition facts were kind of changed a little bit so that like the calorie amount sticks out a little bit more, as well as the serving size sticks out a little bit more. And then instead of just saying how much grams of sugar in the product, it will say like how much grams, and then maybe underneath like how much of that was added sugar. So for example, like a Raisin Bran or something like that. Just so we know, that can be a little higher in sugar. So say, I don't know the number quite off the top of my head, but say it says 20 grams of sugar in the cup of Raisin Bran. Well, underneath it might say 15 grams of added sugar. So that 5 grams might be coming from the raisins, and then the other 15 would be coming from, say, like the basically white sugar that's like coated the flakes, for example. So the difference between the two is like, yes, they both do raise our, but the fruit has all of that, you know, the phytosterols, the antioxidants, a lot of the really good stuff that comes with it. So I don't typically tell people to avoid fruit. If they're struggling with elevated blood sugars or have a history of diabetes or something like that, we might watch what we're kind of pairing those with. But I would say overall, fruits are really good and a good way to get micronutrients in. Does that answer your question?
Yes, thank you very much. So we had another question to come in on our chat. And the question is, are there warning signs that you might need some extra attention to your cardiovascular health, I guess at a young age? If someone could speak about that.
I'll talk about that. And I think that at a young age, you know, obviously when you're in your teens and 20s, you feel invincible, you know, nothing's going to happen to you. You do what you please. And it kind of catches up usually in the, you know, mid to late 40s. You start seeing the signs of the things you did in your 20s. And so this is kind of for young folks. One of the biggest things that I ask my patients is family history. Family history is a prediction of your future. So, you know, for example, if all your parents died at 60, that's something to start looking into. You know, why did they pass away? What are your genes? You know, what have they given you that has already given you a poor start in terms of being healthy? And so really finding out your family history is a really big part. For me personally, you know, my mom is 60 years old. She's, slim. And by 50, she was on blood pressure medicines. My brother was on 2 blood pressure medicines by 30. And so for me, part of my health and fitness, a lot of it is, it's not cosmetic at all. It's just that I noticed that if I get above a certain weight, I develop high blood pressure. And so I pay attention to my blood pressure more, and I try to get it checked more, because I know that eventually, even keeping my weight under control and my diet is not going to control it. And I will need, a blood pressure medicine. Same with, cholesterol. Same with heart attacks. And so knowing your family history and really, focusing on it, to know the places that you need to focus your attention on, because, obviously it's hard to eliminate sugar, cholesterol, and salt altogether, and so that kind of gives you a place. Okay, if all my parents had diabetes by 60, maybe I really need to focus on the sugar and really cut that out versus other things.
Okay, thank you very much. Let's see, we had some more questions to come in. After years of damage to the body, read the heart, are there medications that one can take to reverse it?
Yes, I'll speak to this too. So, fortunately, heart failure is kind of one of the places that we've had a lot of medical advancements. I think that it's really kind of the area of medicine that has the most evidence-based medicine in terms of trials and figuring out medicines to help patients. So there are medicines that, if caught early, can help increase your heart's performance. Like everything, when it's gone too far, there's no reversal. And I think that that's what Chelsea was alluding to. And so there are a lot of medicines that can help repair your heart once it's damaged. But of course, the things that led to it becoming damaged have to be stopped as well. So you sort of can't have your cake and eat it too. And so we do have medicines to reverse, but lifestyle modifications are going to be what keep it, in a reverse state and keep it from progressing to the point that it can't be reversed anymore.
Thank you. I have a question from the audience. I am beginning to have a sinus problem. In my reading, I saw the term sick sinus syndrome. Could someone give information about that and what it is?
All right, I guess I'll take this one also. I hate medical jargon so much because it can get very, very confusing. I mean, even for me as a physician, in medical school, we learn medical names of the drugs. And then when we go out in public, they're completely different names. And so, if I'm confused, I can't imagine, the general public being confused by some of these names as well. So there's our sinuses, which are more colloquially known and known to people as, the things, behind our cheeks and behind our foreheads that kind of get clogged up and swollen when we have colds or, when we have other viruses. But there's actually something called the sinus node in the heart. It's kind of like the electricity panel of the heart that sends the heart muscle information on when to beat and when not to, when to beat and when to relax. And often as we get older, some people, that electricity part of the heart called the sinus node starts doing some weird stuff. It either tells the heart to beat way too fast or it tells the heart to go really, really slow. And so when this happens, we call it sick sinus syndrome, as in your sinus node of your heart is sick. And so it actually has nothing to do with our sinuses. So that can get pretty confusing.
Thank you for explaining that. Great explanation. I had another question. Is GERD heart related? Chelsea, I'm sorry, would you like to answer that?
A lot of people tend to think that GERD is directly related to heart, and it makes you feel so bad that you really do think that it's related to your heart, but it's not. And what I like to tell people, if you're having gastric issues like reflux of this sort, take medicine to reduce that acid. And if you take this medicine to reduce your acid and it's not helping you, then there may be a cardiac issue and you should go to see your doctor. And if it's really, really bad and start giving you chest pain, which we get a lot of times, they thought it was just reflux and they go on for like 2 or 3 weeks with this reflux that they have been trying to treat, but it's not working. Ultimately, a lot of times they end up having a heart attack. That was a signal that something could be going on. And if you would take something, like a Pepsid or something to reduce the acid and it works, then great. But if this continues to be a problem then you really should go to see your physician and have some tests ran and make sure that that's all that it is and it's not a cardiac issue.
Thank you. Could you expand on any of the tests that a physician might do if they think that you have a heart issue as opposed to gastroesophageal reflux?
If you came to the hospital and you thought maybe that you were having a heart attack, they will do an EKG, check your heart, and they will send some lab work off and they'll look for troponins. And in those troponins would let us know if they're elevated that possibly you are having a heart attack. And the numbers, we check them every like 6 hours. And every 6 hours, if the number bump up a little bit more and bump a little bit more, you will probably find yourself going to the cardiac cath lab because we need to go in and take a look to see what's happening. And sometimes that's not the case, but more than likely something is going on because naturally your troponins don't elevate and elevate and elevate without some cardiac issue going on.
And once you've actually had a heart attack, is there any need for a cholesterol medication at that point, or can you just like not take any?
Oh, yes, you will take cholesterol medication. A lot of times they think, well, my cholesterol isn't bad. The doctor didn't tell me that. And, I usually have to go into a spiel about what cholesterol is and what got you into the cardiac catheterization lab to begin with. How did you get chest pain? Because apparently, like Dr. Udy was saying, that fat, that cholesterol is building up deposit along the artery and it's going to block you off. So what causes that if you don't have issues with your cholesterol? So you have to take your beta blockers. You have to take your cholesterol medication. You have to have that baby aspirin. You have to take all the meds that we're given, not just say, oh, I'm just going to take my baby aspirin and I should be okay, which is what I get a lot of times. And we have to encourage them to take other meds that are necessary to take care of the heart.
I want to add on to that a little bit. So, we always get this question. I think it was asked in the panel is, when my cholesterol's fine or when my blood pressure's fine, can I now stop taking the medicine? And, with blood pressure, your blood pressure is fine because you're on the medicine. With cholesterol, even when my patients' cholesterols are pristine, one thing that the general public doesn't understand is that statins are not just that one of their jobs is to decrease the cholesterol, but their other job is to mitigate remodeling of the arteries. So, that was a lot of medical jargon, but going back to what I said before, the statins prevent the plaque from building up again, no matter how low your cholesterol is, because we do have cholesterol floating in our bloodstreams. So if you've ever had a heart attack, no matter how great your diet is, and no matter how low your LDL is, we recommend a statin because your genes have essentially predisposed you to accumulating plaque in your arteries, and statins help reduce that.
Thank you very much for adding that, Udy. Let me see if we have any more questions here. Well, first of all, I'd like to say that Ashley has put a link in our chat. Ashley, would you like to tell us what that link is about?
Yes, it was a page for the dietary recommendations for the Heart Association, and it kind of gave the difference between the DASH diet and a more Mediterranean diet, which is which the Mediterranean diet just didn't consist of as much dairy and some meat, and so was more about fresh fruit and vegetables, but just the benefits of both, that being lower in sodium.
Okay. Yudi, can you expand on all the risk factors for coronary artery disease and what you should do if you have risk factors for coronary artery disease?
Right. You know, I really like to target our younger patient population with this, I'm quite young. So when I say young, I mean like 40s, 50s, which are, believe it or not, are my young patient population. Oh my goodness, it's always so much easier to deal with these things when they're caught early and to prevent them, before you end up being one of my patients in the hospital. So the number one thing, I feel like connects everything together for me is obesity. Big time. I mean, if I, we didn't even talk about sleep apnea, for example. If I see a patient in the hospital that's obese, I can always make assumptions about the diseases they have, not because I'm stereotyping them, but it's really been shown that every time I have an obese patient, they either have they are either pre these conditions or they're going to develop them in a couple of years. So cutting back weight just goes such a long way. I mean, I've already alluded to it with me. I was on the heavier side in my teenage years and early 20s, and I lost weight and my blood pressure went down. You lose weight, your blood pressure goes down. You lose weight, your A1C, the diabetes marker, goes down. You lose weight and it can actually help your sleep apnea. And so really obesity is kind of the thing that I try to target amongst my patients. That is a kind of one cure to all these things. And it doesn't mean that you don't have to still take medications. It just means that if you are obese and you are able to lose weight, it just puts you at so much of a better place in terms of dealing with these comorbidities and having better outcomes with them.
Thank you very much. We are about to wrap up, so I'm going to give everyone a chance to take a minute and say their last thoughts or anything that you want to leave with the audience. Yudi, you can begin.
All right. I always approach this, talk about health and cardiovascular health and lifestyles in a very human way. Because me, myself, sometimes I get that bucket of ice cream out and I can't help myself but eat it. So we're all human. We have issues with inhibition. Food tastes good. And so I want to say that this whole conversation is not to kind of point the finger at people and say, why are you doing this? Don't you know that that's not good for you? Because often we know things aren't good for us. I think what I would take away from this conversation is just helping people highlight the fact that they should put more effort into their health by any means necessary, whether it's, getting a therapist and working on inhibitions and why you can't stop eating chicken wings, or whether it's starting an exercise routine and working with, a group of friends to help encourage you to work to lose weight. So just like quitting smoking, all these things we talk about are quite difficult, and we understand that they're very difficult because we ourselves struggle with them. I think it's just reaching a point where you put yourself in a situation where you're most likely to succeed in attaining and maintaining these lifestyle changes.
Thank you very much. Sarah, would you like to leave some parting words for our audience?
Sure. Yeah, I think probably something I'd love for everybody to take away is to kind of go at it at, I don't know, somewhat of a, what can I add in? Because sometimes I think it can be a little hard to just like, oh no, this is so stressful to like, I have to avoid this kind of a thing. But, you know, if you can think about like, adding in more fresh foods, fruits and veggies, healthy fats, you know, things like that, that will end up displacing that other stuff, right? Because if somebody tells us like, don't think about this, don't think about this, don't think about this, you know, sometimes we only want to think about that. So yeah, try to find the things that we can add more into, and start early. Yeah, that's a huge thing that you have on your side, hopefully is some time, kind of like money in a sense too, right? If we're putting money in the bank when we're younger, that interest can grow and we can really see results of that. So yeah, the earlier you can.
Thank you very much. Chelsea, would you like to leave some parting words?
Yes, I would say with so many changes and modifications that we actually have suggested, I would say take each one bit by bit, you know, because what happens is we get overwhelmed with, oh, my cholesterol is like this, my blood pressure is high. I got to change so much stuff that I just say it's too much for me to do because it's just too much. And I would say take it bit by bit. So if you're a smoker, I would say, you know, it's what's 20 cigarettes in a pack. Maybe this week I only smoked 19 and I slowly wean myself off of that. Or if that's not your issue, if your issue is, I just have a bad diet, I need to do better with my diet, then I'm going to focus in on the diet. You know, do I need to exercise? Let me just put small bits in at a time and take it week by week instead of being overwhelmed with so many changes at one time. But at least they, you know, stay focused on something so that eventually you'll get to the point where you can tolerate having a salad every day or in fruits and vegetables, you know, or maybe the favorite foods that you love to eat, which is in my community, I'm going to say ham, macaroni and cheese, you know, those type of foods. How about we just have that during the holidays? Let's save some of that for holiday eating, not to take it all away, but just not on a regular basis.
That's a really good point. I always like to tell my patients for holidays to leave it at the house that you visited for holidays too. Like you don't get to take it home and eat it the next day. So it's like a one-day event where you get to eat like that. That's really good advice. Ashley, would you like to add anything?
Sure. And I did put a document in the chat box. It's a family tree that you can print out and give to relatives, and they can mark if mom or dad or grandma or grandpa had hypertension, high blood pressure, had some sort of heart episode, and it's something you could pass on to your kids, and especially kids going to college that, you know, may not know their family history if it's needed. But thank you for having me here. With cardiovascular disease, 80% of it is preventable. And so it's all just how we take care of ourselves. And this was some great information to make some changes so we can lead healthier lives. So thank you.
Well, thank you all for coming. I really appreciate it. This was a great conversation. I hate that we did not get our fitness coach to come in. And I would just like to add that exercise is really important for your heart. You know, it doesn't always make you lose weight. And that's where my patients get frustrated. But the benefit to your heart is unbelievable. So you do have to keep doing the fitness. And it might prevent you from having to take medications as early or from developing some of these issues because they're always harder to deal with after you develop them instead of preventing them. Well, thank you all very much for coming.
Thank you all.